All righty, you should be good.
Okay, thank you. It is my pleasure today to introduce our two speakers. William D. Lopez is a clinical assistant professor at the School of Public Health and teaches classes on the social determinants of health, health communication, and the impacts of immigration and police violence on communities of color. The children of a Mexican immigrant mother and Texan father, he grew up in San Antonio, Texas, before attending the University of Notre Dame. He received his PhD in public health at the University of Michigan and continues to do mixed methods work with and for mixed status communities in Washtenaw County. Nicole Novak is research assistant professor at the Department of Community and Behavioral Health at the University of Iowa College of Public Health. She studies the pervasive health implications of racialized immigration enforcement and detention in the Midwest, partnering with multiple organizations in her home state of Iowa, including the Prairie Lands Freedom Fund, the Center for Worker Justice of Eastern Iowa, and Iowa Migrant Movement for Justice. She has a PhD in epidemiology from the University of Michigan and received postdoctoral training in community based participatory research and other community engaged methods at the University of Iowa Prevention Research Center. And with that, I will turn it over to Nicole and Bill.
Thank you. And thanks everyone for joining today. We're really excited to share this project. It's sort of a way to present a project that has been really close to both Bill and my hearts for several years now. So we'll kind of start by telling you the story of the project as a whole, and then what led to this particular digital form of communicating our work together. So our title today is Teaching Immigration Raids Through Graphic Art, ICE in the Heartland, which is the name of the website that we created with the Digital Scholarship and Publishing Studio, including Mark, who's really been such a great contact throughout this. So thank you, Mark. I'm going to start with a lot of acknowledgements because this is very much a team project, not just within universities, but also with communities. Dr. Lopez and I have been working on this project for several years. Just by way of background, we actually met when we were both PhD students in public health and began to do some community engaged work between Michigan and Iowa together. And we've just kept at it several years later now. The project that we're sharing is also done in partnership with people from rural communities that have had large worksite immigration raids. We'll explain more about that, but we wanted to upfront say that we couldn't have done it without the insight and support of people in each of the communities that we worked in. That includes Julio, Tammy, Veronica, Kelsey, Gladys, Dalila, and other people in the communities who met with us, showed us around, and shared with us what had happened in their town. We also had fantastic students come with us on about half of our fieldwork visits. So some of them are listed here. And there's a few others who have gotten involved in the analysis phase as well. Just as a plug here, we are holding Bill's book, Separated, which I would encourage you to check out. That's about an immigration raid that took place in Michigan and was one of the kind of foundational works that motivated this project, which is about different events. Also, we're going to be sharing today this website that came out to kind of share the project with folks, and that was with great contacts at the Digital Scholarship and Publishing Studio, Ethan, Alyssa, and Mark. I think I saw Alyssa on here too. We're going to show off some of the logo and other pieces that she made for the site as well. And then lastly, the actual content of the site is over and above the research that we did in each of these communities. And Bill will share more about that process, but we want to make sure to acknowledge the great creative contributions of Dahlia Harris and Carolina Jones. You'll see their art later on in the talk. And then this project is funded by a bunch of different groups, including the Prevention Research Center for Rural Health at the University of Iowa, and then at Michigan, the Institute for Research on Women and Gender, and the Documenting Criminalization and Confinement Collaboratory. And then we also got fantastic in-kind support from the Digital Scholarship and Publishing Studio. So I'm going to just share background on the project that is presented in the website here. You're all in Iowa or working for the University of Iowa, so you may already be familiar with the long history of worksite immigration raids. Iowa actually was kind of notorious in that area because in 2008, there was a large immigration raid in Postville, Iowa, in Northeast Iowa, which was at the time the largest single site immigration raid in US history. Iowa has also had raids in Marshalltown, and they've often targeted meatpacking plants, things that are really distinctly kind of rural occupations. And this form of immigration enforcement has ebbed and flowed over the years. The Postville raid was under the George W. Bush administration, and then there was a turn to other enforcement tactics. Actually, under the Obama administration, there was still a lot of immigration enforcement, a lot of deportations, but this particular tactic was not used. And then in 2018, the tactic reemerged. So 2018 saw the return of large-scale immigration raids where dozens to even hundreds of workers are arrested in a single day. So this report indicated that there was a 400% increase in worksite immigration raids in 2018. And actually in 2019, the following year, was a series of raids that actually broke the Postville record, the regrettable record. And in Mississippi, there were even larger raids in 2019. For our project, we ended up focusing on the 6 largest worksite raids in 2018. They occurred throughout the spring and summer of that year. And you can see a table here that has the date of the raids, the locations, the industry of the worksite that was raided, and then also the number of arrests. And a few things you can note just by scanning this: it's mostly kind of agriculture adjacent industries or light manufacturing, and it's almost universally in rural areas, and all in the heartland. You know, something really important is not on the border, and I think that's a really important piece of this project that we want to communicate, is that immigrant rights, immigration enforcement is not just a border issue. It's surrounding communities where many people live, including those of us in Iowa, those of us in Michigan, and throughout the places these raids occurred. I'm going to share kind of from the science side how we did this study. I'm going to share it pretty quickly because I want to leave a lot of time for Bill to share the artistic representation in the website, but we can talk more about the particulars of the research side in the question and answer if people would like. So we went into this as people who have already studied immigration raids for a long time. So as Bill has a book about immigration raid that took place in a home in Michigan. And as part of my dissertation, I studied the implications of the Postville raid in Iowa for birth outcomes in the state of Iowa after that raid. So we had both already done a lot of thinking about these events. We had done a lot of reading about them. We're in public health, and at that point, we didn't really think that there was a lot of empirical question at this point about, you know, are these raids good or bad for people's health? We felt like that question was pretty well closed with research we had done, and then also with relationships we had with community and research by other scholars on other immigration enforcement related issues. But with this new spate of raids in 2018, we saw an opportunity to document once again the implications of these raids for rural community health. We were especially interested in looking at not just individual level impacts of raids, but impacts on families, impacts on communities. And then another really important piece of it for us was not just documenting these harms, but also documenting the ways that people respond, because there's a really remarkable and wide range of ways that communities mobilize in the wake of these events. So our secondary question is, how do communities respond to care for one another and mitigate harms? We're both in public health, so we used, for the research portion, community engaged methods. As I mentioned before, we had community partners in each site who provided background on the community, and helped us invite people to participate, and then provided feedback throughout our analysis and dissemination process. You can see at the bottom that this study was reviewed by institutional review boards at both institutions. And then we traveled to all 6 of these communities. And so we also took some field notes, anonymous, not on particular people, but on the context in different places with local organizations that responded to the raids, the actual work site where the raids happened. And we often went to churches, which were one of the major players in responses to raids. Our primary source of data was in-depth anonymous qualitative interviews with anyone who was involved in responding to an ICE raid. So often this included teachers, immigrant rights advocates, people of faith, people in different churches usually in these communities, legal professionals, and then other volunteers. And people used pseudonyms. It was completely anonymous. With permission, interviews were audio recorded and transcribed. Throughout the process, we also began to just come across a lot of archival and secondary data that was really important for documenting what had happened. So a lot of media reports on the raids. Also, sometimes the arrest warrants that ICE or other law enforcement agencies used to begin the raid were sometimes available and just publicly available, as well as court documents. And then we also made sure we found demographic data on each community. So we ended up in the end doing 79 interviews in 6 communities throughout the rural Midwest. It was really just a labor of love for, I think, both Bill and I, and then ultimately the students who came as well. And we really treasure the relationships we were able to build with people in each community. Something that's really important to a lot of people in public health, and I think definitely for Dr. Lopez and me, is not to do research just for other researchers. Especially when the community had given us so much, and at times that were really difficult. And we also sensed the ways that communities, in each one, it felt like this really isolating event, this kind of out of nowhere, unexpected shock, or maybe something that people had always feared would happen, and it finally came. And what we were able to see from going to 6 communities was that people weren't alone. They weren't alone in their own community. They were caring for each other, but they also had a lot of common experiences across sites. So many. So this thing that felt really random and chaotic was actually quite systematic. And there were other ways that people between different rated communities were getting introduced to each other and connected, but we also saw an opportunity to make sure that we were sharing these results publicly in a way that helped underscore those kind of common experiences across sites. We wanted them to be accessible to people in terms of the language used. For publishing for our public health colleagues, we need to kind of put things in certain frameworks, and we wanted it to be more just real with people everyday experiences. And so we ended up approaching the Digital Scholarship and Publishing Studio, and they've been so generous with their time, their expertise, as we've gone through what ended up being an iterative process to develop this, and we're really, really thrilled with how it's turned out. I just wanted to share a little bit of background on some of the nuts and bolts that we're really excited about. Alyssa, who's on here, worked with us on a logo for the website. And I think, that's not something we get trained on in public health, is how do you distill this huge thing you're doing with all these people and all these places and all these ideas and all this pain, how do you distill that into an image? We went through a few different things, but something that we felt like was really consistent across these towns was water towers. And for those of you in Iowa, it's just kind of a landmark of a lot of our smaller mid-sized towns. And every town we went to would have a water tower. It has the name of the community. It's a community resource. We liked it too because it was identifying the community, but also through sort of an asset or just something that's there, not just through the pain and the damage. And then we also wanted to make sure to connect it with the issue of immigration, which is the core of the violence that occurred in each of these towns. And so we ended up deciding to include a butterfly on the water tower image. Bill has a butterfly right next to him. It's often an image used in the immigrant rights movement because butterflies migrate. And I believe actually there's another website through the Iowa Women's Archives. I don't know if you were all involved with that, but it also uses butterflies to talk about migration. But it's a very treasured symbol for the immigrant rights movement in the US. So we are grateful to Alyssa for working with us. It turns out that the kind of bulbous type of water tower does not really read as a water tower if you just have a little image of it. So she helped us find one that was a bit more identifiable and actually is the same as the water tower in O'Neill, Nebraska. I'm going to hand it over to Bill now. So I will stop sharing. There you go.
Great. Well, thank you so much, Dr. Novak, and thank you for the team for having us today and for all the work you've put into helping us develop this webpage. Um, so Dr. Novak gave us a bit of background on kind of the nuts and bolts of the academic side of the study, but also on our motivation, for doing it. And as she said, these raids were in ways personal, right? So we had both done our research, we both did our dissertations and already studied that raids were pretty bad for people's health, right? That was not up for debate anymore in our heads, and we wanted to see, what do communities do to mitigate the damage of these raids. As public health professionals, though, we do believe it is continually important to document the things that are wrong with these practices. So thus we did that, as we'll show you here. And in part 2 of this project, which we'll work on soon with the artists, as I'll describe in a moment, we'll also share illustrations on what communities did to respond. But part of what happens when we're engaged in this project, when you're engaged in research, while the research is all over the news, or while these events are all over the news, is that a lot of media actually reach out to you, right? So this is an interesting position to be in as academics, because academics often aren't trained to deal with the media. We're pretty verbose, we tell overly complicated stories, and the media doesn't really need that or wants that, right? So we, after being contacted with the media and in being in other spaces, such as public health spaces or in public spaces, have been struggling. What do we do with this data, with these data, and how do we do it kind of on the short term, right? This is happening right now. This isn't something we wanted to follow the normal academic cycle and come out in 5 years. To give you an example, we just got a paper accepted that will be published probably next month. So had we never spoken about things till a paper came out, right, we would just start now in an entirely different presidential administration. So we struggled with what methods we wanted to use, and we knew we were coming into this with a few things in mind, right? We want to quickly and concisely relay the impact of immigration raids. And I highlight quickly and concisely because we want to be quick and concise, but we did not want to be reductive, right? We still want to tell a rich and emotional and powerful story that's often complicated. We just had to figure out how to do it without having to spend an hour talking at a reporter in one direction, right? And we wanted to do this for different audiences. You can see here that includes Spanish and English media, which through our research, we saw had different understandings, understandably, right? Different understandings of what raids look like, right? So often the English speaking media, many folks were kind of just coming to understand raids at the same time. Reporters didn't speak Spanish and didn't necessarily have people to interview in the way that Spanish media did. We wanted to relay the impacts of these raids also to those who are entirely unfamiliar with immigration enforcement, right? So there are people who never thought about immigration enforcement before until they saw these raids on the media or saw the border separations that happened during the Trump administration, right? When these conversations began to happen. At the same time, we wanted to be respectful of the communities who have experienced these raids, who have always historically been the targets of immigration enforcement, or have seen, especially younger undocumented folks or younger folks in mixed status communities, who have seen their parents arrested in raids, right? So we needed to find a way to be quick, concise, while telling a rich and nuanced, yet respectful story. I'm sure you can understand there's lots of challenges in trying to find a method like that. And we also wanted to do it wearing a couple of different hats. So as public health professionals, we wanted to center health, right? Immigration enforcement impacts health. People who experience it, it impacts lifespan, health outcomes. Basically, immigration enforcement can make you sick. We wanted to continue to relay this point. As scientists, one of our strengths is that we know how to systematically collect data, right? So this means we do believe in the strengths of narratives and vignettes, but more so if we systematically collect those narratives, collect those stories, and share with you what they have in common, what they don't, and the themes that are kind of flow through them all. As advocates, we also wanted to prompt people to action. So this was not just about like, here's what the next research project should be. This was also like relaying the urgency of something and what to do next. And as professors, we think about how do we teach about the bigger issues here, right? Such as historical racism that has been part of the immigration system. So wearing all these hats, we kind of needed to develop a method to relay this information. So what we worked on, we call today graphic interview-based representational art, or the acronym HIRA, which I'll describe for you what it means in Spanish shortly. And I'll go over what each of these words mean. So graphic, as in, which you'll see graphic art, right? We believe this type of graphic art can be used to relay complicated, emotion-laden stories quickly and powerfully, right? Sometimes it won't relay the whole story, but it'll relay a powerful and engaging aspect of it and allow for an entry point into much larger conversations. This is interview-based art, right? This means that each image is drawn from systematically gathered interview data. So we didn't want to just show the perspective of, let me start that over. I'm skipping to the next point. So gathered interview data utilizing established research techniques. So like I said, we also wanted to draw on the skills that we spent multiple years of our lives learning in our PhD program, right? And share that systematically gathered data. It's also representational. So these images represent much more than just the artist's expertise and the artist's perspective, although they certainly do, but they also include interviews, as I described, and media and personal experiences of the team, and our discussions having been in these places and spoken with these communities. They represent something bigger than the individual image, and they're art, right? And while I'm biased as a text author and do believe that writing can be art, we believe the term art gestures towards, what the public generally thinks of as art, which is something visual, so representing some kind of visual art. I also like the word hira. Hira means to turn. Girasol is a sunflower, right? The Spanish word for sunflower. We've been describing this work and describing it in two phases, right? So first documenting the harms of immigration enforcement, what I'd say Nicole and I spent a good portion of our personal and professional lives doing. And then we want to go to this next phase where we're documenting the strengths of communities to mitigate and care for this harm and care for themselves. And I'm also taken back to a quote that I got from an interviewee after an immigration enforcement raid that I wrote about, as Nicole mentioned. And Hilda's husband was arrested in this raid as he drove away from this raid. And I asked her, how does this change your life when your husband is arrested? And she started to describe to me how much more scared she was, right? How much more cautious she was. And she said, yeah, this really changed us. We were much more cautious. We always walk turning around, making sure there's not a patrol car nearby. Andamos volteando, a ver que no está una patrulla alrededor, right? She's saying, I'm always turning around, turning over my shoulder. So I thought this speaks very powerfully, right, to this gesture of turning backwards. And we like this image of the sunflower, this girasol that's always turning forwards, turning toward the sun and looking for opportunities to care for itself, to follow the light in these cases. And as we move toward the next phase, this is exactly what we hope to illustrate, how communities not only turn behind, right, not only must look over their shoulder for immigration enforcement and surveillance, but also turn toward each other to care for each other. So using this HIRA method, we developed the website along with the team who helped us put everything in our heads into somewhere you could see on the web. To develop the Ice in the Heartland site, which I'll show you. I'll show you the images from here and a little bit of the website as well. I love this cover photo, this landing page. Landing page is probably the appropriate term. We also had to learn a lot of new words, right? In dealing with web pages. So you can see here each of the states in which each of the communities we visited is marked by a star and their states are covered with an image of what we believe to be consistent across all of these states and all of our experiences. And that's lots and lots of sky and lots of highway and roads, right? This is really the heartlands of the US. This is, though you see Texas, you definitely see it's up north, the northeast border, more toward the central US. I'm from San Antonio myself, which is much closer to the southern border. And now living in Michigan, I see the differences, right, in how immigration enforcement takes place. In the heartland, this is not where Border Patrol are driving every day. This is where collaboration with police or ICE raids are the ways in which people are arrested. I'll also note here, and it is that one of the larger impetuses for beginning this project was not only the intellectual and academic professional desire to document what's going on, but just because we were personally angered, offended, hurt by what was going on as these raids were happening. We were getting texts from folks who were involved, and including in our home states, right, of Texas and in Iowa. That's one of the things that really motivated me to take on this project as well. So I want to show some of the images before I show how they're laid out on the web page, because I just want to give you a bit more of a chance to look at them. While you're looking at the image, I'll talk a bit about it and talk about the process in a little more detail. So we worked with the two wonderful artists who both identify as Latina or Latinx, and who both described connections to immigrant communities. When they each discussed with our team, who had either looked at interviews, conducted interviews, or done deep dives into media, and discussed what these raids look like, right? So as a bit of a focus group in our team to kind of come up with the ideas and come up with how we were going to divide the themes into these different images. And then the artist would present us some kind of traced drawing, so no color added, just kind of a representation of what they were envisioning. At this point, the team of students would come back with recommendations, and I like this is how you work on this would look more like this, etc. Until they finally presented an image. And we often worked on the titles together, or label the title based on one or more themes that are going on in the image. And I'll just describe a couple of them so we make sure and leave time for question and answer. But in this image, the tin barn looking building in the back is meant to resemble the barn in Bean Station, Tennessee, which is the first community we visited in which a meatpacking plant was raided. And in one of the stories about this raid, an interviewee described the way these raids, these agents would often look toward the Latinos in the building, huddle them into a corner, gather folks into a corner, and then ask everyone for their documents, while letting the white workers stand elsewhere, including taking a cigarette break while they watched the darker skinned workers be taken away by ICE. This image also calls to mind a shifting gender dynamic under the Trump administration. So under the Obama administration, it was certainly mostly men, and historically has been mostly men that were arrested. One of the changes we see in the Trump administration was this lack of use of discretion. So it was discouraged to use discretion, and everyone possible was arrested, including in many cases, women, if they were working in these factories. Immigration raids result in large-scale family separation. So what I document in my book is the way this home raid caused multiple family separations. And this is on the scale of 10 times more than what I saw in these raids. Often we see individuals who don't know where their family members are. And as raids unfold, nobody knows where they are, how long they're lasting for, or if they're even stopping at a single location, or if they'll extend into other buildings and other houses. Folks will go into lockdown, but mostly there's this air of confusion about who's missing, where they are they hiding, or have they been detained? There's also, and I remember the artist describing this image as she tried, and I would say successfully captured this bittersweet and often emotionally confusing moment of finding your loved one, but finding him captured, right, detained. So there's the joy in knowing that someone is not gone and someone is not missing, but there's also the simultaneous struggle of knowing that there are myriad next steps now to figure where he's going to be detained, under what terms, and how you're going to address it, and often how you're going to explain it to your children. Atentas a todo, meaning attentive to everything. So this is drawing again on this theme of hypervigilance. And I really love the way she's also turning over her shoulder, right? Looking back, trying to figure out what's going on. And in this image, we are called to mind Sandusky and Salem, the Ohio raids. I believe it was the Sandusky raid when there was a Black Hawk helicopter that circled overhead, similar to a helicopter that circled in Postville, Iowa. But often there would be some clues that community members would pick up on that a raid was going to happen, such as the presence of an ICE bus or an influx of agents staying at a hotel. One of the things I learned and we've learned in conducting research about raids, these are often seen as these spectacular moments. And I don't mean spectacular in a good way. I mean as a spectacle, right? These highly visible militarized moments of violence that take place. And they certainly are. But part of what's most jarring is the way they infiltrate people's everyday lives. You taking your daughter to get ice cream, as you see in the image, and looking over your shoulder, and just that moment of dread that, oh, something's unfolding. I've dreaded this for years. I read about this in Postville happening a decade ago, and now it's finally happening. What we saw in many raids also is that they may sometimes involve trickery. So what was captured in this image in the Ohio raid is that agents dressed in plain clothes invited workers into the headquarters, what I want to say, like the pavilion, invited them in with donuts and coffee, and then arrested them, right? So workers were not able to, workers didn't know that these were ICE agents. The artist here described how she wanted to contrast the colorful donuts with the, with the zip ties, and here you see color and lack of color. But you also see what looks like a general working table, right? A table that you would see in any given kind of office space with general coffee cups and such, and a sign-up sheet, free citizenship classes. So this gesture towards the fake friendly agents that ultimately arrest you. This one's actually captured in a GIF. I'm going to come back to it because I really like the moving image that's not there. And so as I said, this is part one. Our artists are currently working on the second iteration, which will be images of how communities respond. Because communities are creative, resilient, and beautiful. Like migration is beautiful. We think about the butterfly and the saying, migration is beautiful. These communities are strong in the face of this surveillance and of this targeted and often racialized and militarized surveillance. And we want to highlight both sides of that. Before we thank you and share our name, I just want to go to show a little bit of the web page. Because part of the story is not only the images themselves, but anchoring the images with a bit more description, right? So as you can see, and here's an example, you'll have the zip ties and donuts, you have the image. Then we have a description of this aspect of the raid. We tried to bold the really important lines, right, that we wanted the media to take away, an artist statement, and then two other sections I want to call your attention to, the public health implications, which again, our attempts were to relay very concisely so the media would understand quickly that, oh, raids are more complicated than I thought. Let me tell this part of the story too. And all this grounded in the stories of pieces of interviews from those who experienced the raids themselves. Experienced the raids or provided support after the raids. And lastly, let me show this image. So this image, this GIF, Too Scared for Soccer, was meant to call to mind the ways in which after a raid, again, community members don't know when a raid is going to end, nor how far it's going to extend. And one of the most efficient ways to reduce your risk of deportation is to lock yourself in your house and draw your blinds and avoid going out, right? As public health professionals, we know this eliminates opportunities for social support. You're not going to the doctor, you're not doing simpler things like going for walks. So there's many health implications to this. But this image clearly capturing kids playing soccer and then a kid alone, unable to play soccer. both a sport that we saw played, right? We saw soccer ball and soccer goals in the community we visited, as well as suggesting that these impacts are on children too, right? Who are too young to work in these rated facilities, but are nonetheless impacted by these immigration enforcement events. So I'll stop there. And just share our emails and my Twitter handle as well. So thanks so very much for listening. Thanks for the wonderful work and collaboration and working through this website and we developed these methods to tell more complicated stories about something that was happening with increasing frequency during the previous administration. We look forward to talking more about it. We're happy to answer emails and we're happy to take whatever questions you have.
Yay. Thank you, Dr. Lopez and Dr. Novak. I'm going to go ahead and stop the recording now. Yay.